Welcome friends to this part 20 of the solved Pharmacy MCQs video series. This is again another set of 10 MCQs, and we will be starting to discuss them in a little while. So friends, big welcome and thanks for joining me. So without further delay, let's start this new set of MCQs. So our first MCQ of this video: Prometric is used in high cholesterol, high blood pressure, high blood sugar, food poisoning, and in hyposexuality. So actually Prometric is an anti-diabetic drug, that is, it is used in the management of high blood sugar. It is actually an amylin analog, this Prometric, and it is used for treatment of high blood sugar. So C is the correct option here. Now moving on to the second MCQ: the ingredients other than active substances in a pharmaceutical formulation are generally referred to as inert ingredients, excipients, extra substances, formulation builders, and all of the above. So actually the MCQ asks about the ingredients that are other than the active substances in a pharmaceutical formulation, what they are referred to as generally. So actually they are mostly referred to as excipients. Inert ingredients, not because all the substances in a pharmaceutical formulation are not necessarily inert apart from the active substance. For example, we have magnesium stearate. This is actually an excipient that is used in pharmaceutical formulations. So that is not actually so inert, because in doses that is higher than the recommended level in a pharmaceutical formulation, they can produce diarrhea. So magnesium stearate, although it is an excipient, but it can produce, of course, in higher than recommended doses, diarrhea. So it is not so inert. So they cannot be called as inert ingredients. Then there is this extra substances option. They are not also extra substances, they are needed in the formulation, so they cannot be called this as well. And formulation builders, because all the substances in the pharmaceutical formulation are not actually formulation builders. For example, magnesium stearate, this actually is used in the formulation in order to reduce the sticking of the medicinal material with the machinery. So magnesium stearate is not a formulation builder, it is actually for the management of the smooth flow of the capsule production process. So they cannot be called as formulation builders as well, because not all substances are formulation builders. So the correct option here is B, excipients. There are active substances in a pharmaceutical formulation, and then there are excipients. Now our third MCQ: amylin analog is used for high blood cholesterol, high blood sugar, hypersexuality, low appetite, and high blood sugar. Actually amylin analog, this is actually a class in anti-diabetics drugs, and we have learnt in our first MCQ pramlintide. This is actually an amylin analog. Pramlintide is an amylin analog, and it is, as we have come to know from the first MCQ, that it is an anti-diabetic drug. So amylin analog is used in high blood sugar. Now the fourth MCQ, acarbose is anti-cancer drug, antacid remedy, antiviral drug, anti-Parkinsonian drug, and anti-diabetic medicine. Actually, acarbose is anti-diabetic medicine. This is actually used in the management of high blood sugar, especially type 2 diabetes. Now our fifth MCQ, Zolbi is brand for omeprazole, esomeprazole, albendazole, zolpidem, and zelcetabine. So actually Zolbi is a brand name for omeprazole. Omeprazole is the generic of Zolbi. So Zolbi is omeprazole. Now all of the following are antibiotics except one: ciprofloxacin, nalidixic acid, zoledronic acid, clavulanic acid, and streptomycin. So we know that ciprofloxacin is an antibiotic, clavulanic acid, streptomycin, and nalidixic acid. These are all antibiotics, but C option, zoledronic acid, it is actually a bisphosphonate, and it is used in the treatment of many bone diseases. Like osteoporosis, high blood calcium due to cancer, bone breakdown due to cancer, and Paget's disease of bone. So these are the many uses in the bone diseases for zoledronic acid. So zoledronic acid is not an antibiotic here. Now the function of trigeminal nerve is eye movement, face sensation, head and neck movement, control function of spleen, pancreas, and liver, controls sympathetic activity in body. So actually a trigeminal nerve, the correct definition for this nerve function is face sensation. So trigeminal nerve is actually involved in the functioning of face sensation. Now our bodies will try to maintain its homeostasis against the developing incidence of high blood pressure via which of the following mechanism or mechanisms? So options are baroreceptor pathway, positive and negative feedback mechanism, renin-angiotensin aldosterone system. D option is both A and C, and E option is all of the above. Actually the homeostasis that our bodies will try to achieve while the blood pressure rises, then these all mechanisms are involved in that effort of achievement to homeostasis. So baroreceptor pathway is there. At this point the elevation in blood pressure is sensed, and then it is sent to the central control system of our body, that is brain, and especially hypothalamus region, from where many of the functions are controlled and regulated. So then renin-angiotensin aldosterone system is there, this pathway is also involved in the homeostasis. So actually all of the above options are correct. So E is the answer to this MCQ. Now moving on to the 9th MCQ. The purpose of adding absorbents into the formulation of capsule dosage form is it's about actually the purpose of adding absorbents into capsule formulation. So options are: prevent sticking of granules on punches. This is actually mostly the function of lubricants. Then B option is increase the drug solubility. This is also not the function of absorbent. Prevent degradation of hygroscopic material. This seems to be pretty much closer to the definition of absorbent, because if we read the other option, prevent dusting from automatic capsule filling, and all of the above are correct. So definitely all of the above are not correct, and this option, that is C, it seems much closer to the definition of absorbent, because these substances are added in the capsule dosage form design to prevent the degradation of hygroscopic material, meaning that if some hygroscopic material is used in the capsule dosage form building, then of course if that moisture somehow absorbs moisture, then it will lead to the degradation of this formulation. So we have to protect this material against moisture, because this material is hygroscopic in nature. So absorbents are added, and that absorbents will absorb any moisture that becomes available in the surrounding, and so preventing the degradation of our formulation. So C is the correct option here, friends. Our last MCQ of this video, friends, is angiotensinogen is produced in the bone marrow, blood, liver, kidneys, and adrenal glands. So these are the options, and the correct option here is that angiotensinogen is produced in the liver. So liver is our correct answer here.